So my name is Robbie Lettieri. I'm the Long Island Regional Youth Partner with Families Together in New York State. I'm really excited about this presentation today, Navigating Mental Health in the LGBTQ+ community. So we have Maria Demauro here from Pride for Youth, which is an agency here on Long Island. And I'm really excited to have her present for you all. I know she's going to be amazing. And we will take some time at the end of the presentation for questions. Maria, depending on your comfortability, if you would like people to ask questions as you're going through the slides, that's great, just let us know. And then if not, we will have like 10 to 15 minutes towards the end where we'll have more conversation.
Wonderful, Robert. Thank you so much for having me. I am totally comfortable with questions during the presentation, after the presentation, before the presentation. I love answering questions. So please be curious. I'm happy to be here and have this conversation with everybody. I'm going to take a second to share my screen. There we go. Can I just get a thumbs up that everybody can see this okay?
You've reached Nadia Watson.
Fantastic. So thank you so much for having me here today. Thank you for being here today. I am Maria Demauro. I am the Community Mobilization Coordinator at an agency called PFY, and I'm here to present on navigating mental health with the LGBTQ community, specifically for counselors and mental health workers. So today, I'm not only here to talk about the LGBTQ community, but we're also going to take it a step further, and we're going to focus on the mental health piece of working with the LGBTQ community. So we're going to cover the impact that sexual orientation and gender identity have on mental health. We're going to talk about gender dysphoria and how we can work with it, the do's and don'ts of serving the LGBTQ community, and finally, how we create an affirming environment in our own therapeutic spaces. So like I said, please feel free to ask questions throughout the presentation or after. Either is totally fine with me. I just can't see you or the chat. So Robert, if you wouldn't mind, if anything is pressing, like just please feel free to interrupt me. This presentation goes through a lot of information though, so I do want to, this is one of those presentations where if you have a question on your mind, it is likely that I'll answer it, but please ask anyway. I'm happy to chat with you. Oh, I gotta, bam. All right, so my name is Maria. I'm a licensed social worker. Essentially, my job is doing trainings across Long Island. I also am a counselor myself for young LGBTQ people with a specialty in gender therapy. I facilitate the trans and non-binary group at PFY, and I'm also the co-chair of the Ending the Epidemic committee on Nassau County. So I do quite a lot of things, but essentially my job is to get people excited and educated about working with the LGBTQ community. It's important that we all know that just because we're not in an LGBTQ setting doesn't mean that we're not working with the LGBTQ community. We are everywhere. So really quick, when I say LGBTQ, that stands for lesbian, gay, bisexual, transgender, and queer and questioning. Usually you'll see a plus or an asterisk after that because LGBTQ doesn't cover all of the identities within that community. There are a lot of other identities in there as well, which we'll get a little further into throughout this presentation. But I just want to make sure we all know what we're talking about here today, and I'm so excited to get started. So like I said, here are the goals of the presentation. We're going to explore sexual orientation and gender identity and how they impact our mental health. We're going to talk about gender dysphoria and how to be an affirming mental health provider and also creating that affirming environment. I do a lot of trainings for PFY across a lot of different organizations, but I have to admit that this specific training is my favorite one. I think this is so important and it hits a personal nerve for me as well. Everybody here who is working in any capacity in the mental health field, who has an interest in the LGBTQ community, if you do your own research, you might find in frustration that there is not a lot of research out there that isn't focused on HIV, isn't focused on substance abuse or suicide. There's not a lot of just how to work with the LGBTQ community. What are some tips? So that's why I'm so excited to be here today. This training was created from the heart based on a lot of experience. So we're going to start by briefly reviewing PFY Services. Again, PFY is the organization I'm coming from. our counseling program, and some of the common complaints that we hear from clients about other mental health providers. So the PFY counseling program offers free mental health counseling services to LGBTQ folks through age 30. Counselors are trained to work with the LGBTQ community, and the counseling program has a focus on gender and sexual orientation. We also offer counseling services for folks who are seeking letters for gender affirming medical care. So what that means is that if a trans person wants to begin hormone replacement therapy, so you would maybe start taking testosterone or start taking estrogen, doctors typically require a letter from a mental health professional. So we work with clients to write that letter with them if it's appropriate, and we're highly trained to provide resources for gender affirming medical care as well. After this presentation, I'm going to put my contact information in the chat. So if you want to reach out to me to get connected to PFY Services, or if you just have any questions and you'd like to chat with me, I'm really happy to do that. So I'll make sure to put that in the chat after this presentation.
Hey, really quick, Maria.
Yes.
Julie actually you have to live on Long Island to access this.
That's a great question. So the counseling services, you do have to live on Long Island or in New York City boroughs. We can connect with you. But outside of New York City and Long Island, we can give you referrals. Same with out of state, we can give you referrals. That doesn't extend to our groups. We do have groups for all different identities within the LGBTQ community, like a trans group, an LGBTQ youth group, etc. Those groups you can be from anywhere within the United States. Thank you.
Awesome, thank you.
So when we were creating this training, I surveyed PFY clients, and this is from hundreds of clients, typically ages like 13 to 30 years old. And I asked them, what is the biggest thing that's keeping you from accessing mental health services? Because studies show that LGBTQ people are less likely to access mental health services, even now when mental health services are so normalized. So I asked, what's keeping you from doing it? What would you tell your therapist if you could? And these are the two most common complaints that came up. So the first one is, I feel like I have to educate my therapist about my identity. I spend so much of session just explaining what being transgender means. It takes away from my actual process and progress. I'm sorry. The second complaint that we heard a lot is, as soon as I am misgendered or dead named, whether it's by my therapist or the front desk, I feel completely off for the rest of session and I don't feel quite comfortable from then on. So when I say misgendered, that means that you're calling somebody the incorrect pronoun. So a pronoun is how you refer to somebody when you're not saying their name. So Maria did a presentation, she had a PowerPoint. So my pronouns are she and hers and herself. If you misgendered me, maybe you would call me he by mistake. Dead naming somebody is calling somebody the wrong name. Usually trans people go through this when they change their name and folks are still using the wrong name for them. So their birth name, their dead name. So one of these things is something we can help by educating ourselves, right? If we're talking about misgendering and dead naming, we can strengthen our cultural relevancy and attend classes like this. However, the other one where I feel like I have to educate my therapist about my identity, that might take a little bit more work of what kind of space are we creating in our therapeutic environment? What kind of space are we creating for our clients coming in? So here are some things that we can do as a counselor. So like, these might seem like little things, but they send big messages. First, we have a stop sign that has a rainbow on it. It says, safe zone, I'm an ally, I'm understanding. On the other side, you see that rainbow triangle that says safe space. This is something we see a lot in schools. Very easy to find products like this online and just stick it in your office or your virtual office. The pink and blue flag that's right below the stop sign, if you didn't know, that is the transgender flag. So while we see a lot of rainbows out there, that's really awesome. When you have a transgender flag, it shows that you know the community, and it's a really great message to everybody. So I highly recommend just having wonderful rainbow trans flags, any LGBTQ flags around your space. The one in the center, I know this isn't as relevant since we are virtual, but I really love this. It's a sign that says we care about your pronouns. And right next to that sign, there are stickers with different pronouns on them. So if you look closely, you can see some of the stickers say he, him, she, her, they, them. And what I'm imagining is that this sign is at the front desk. This is really awesome because you are taking the burden off of the client to have to say, actually, I use these pronouns, or actually, can you call me this? Instead, it's totally normalized. A client can just take a sticker, put it on their shirt, and now they're telling everybody what pronouns they use. I just love this, and I think it's a fabulous process to put into your space. So these might seem like small, simple changes, and they are, but it can change an LGBTQ person's entire therapeutic experience. And it'll be their very first impression that they're safe and they're accepted for who they are. But we cannot just throw a rainbow in our office and call it a day. We have to create the affirming space. Huh? So in order to create an affirming space for the LGBTQ community, we also have to talk about what is it? Oh, I'm sorry. Can everybody mute themselves?
If you tell somebody that you're going to do it.
Can I please get their mics?
First, okay, so I got a hold of one guy on there. So looked up the website for it. And he's
I'm
like,
so sorry.
the only way you can do it is if you come to court here. I was like, well, I'm in Batavia, New York. That's this. I'm in a living facility here. So, and I am on probation here.
Can everybody hear me if I
Oh, that's the only way. So I freaking hung up on him because I was going to cuss him out. So I'm putting my dick on him for that reason.
I'm trying to.
And then I called.
Okay. Sorry about that.
No,
Sorry,
no.
Maria. Thank you.
This is part of virtual learning. Thank you, everybody, for your patience. I appreciate it. So in order to talk about how do we create an affirming environment for the LGBTQ community, we need to talk about what does being LGBTQ mean for our mental health. So I'm going to be talking about sexual orientation and gender identity. And I want to distinguish that there is a difference between sexual orientation and gender identity, even though they are both included in the LGBTQ community. So your sexual orientation, that's who you're attracted to, right? That is the gender you are attracted to. So if I were to say I'm gay, that's my sexual orientation. I'm talking about who I'm into. If I'm to say I'm straight, again, sexual orientation, bisexual, pansexual, asexual, those are sexual orientations. They have nothing to do with my gender. They're who I'm interested in. Gender identity is my gender, not who I'm attracted to, but how I identify. So if I say that I am a transgender woman, that's my gender identity. If I were to say that I am a cisgender woman, that is my gender identity. The term cisgender basically just means that you're not transgender. It means you didn't have to transition your gender. It's not something you changed or explored. So if you are not trans, you are cisgender. If I were to say I'm non-binary, so somebody who is non-binary, that means that they don't identify as completely 100% guy or completely 100% girl. Maybe they're somewhere in between that. Maybe they're completely outside of that. Essentially, it means that we do not identify with male or female. So again, if I identify as non-binary, that is a gender identity. None of those things have anything to do with who I am attracted to. So let's talk about how sexual orientation and gender identity impact mental health. So the following things can impact your mental health in a negative way if you are LGBTQ, but I do want to also say that these things are not unique to the LGBTQ community. Other cultural groups like religious groups, races, ethnicities, etc., can also relate to a lot of these experiences. So one, not seeing yourself in the media, seeing yourself in school history, seeing yourself in political figures, Not seeing yourself in your own family. Maybe everybody in your family is straight. You might feel a little bit isolated, ostracized, like you are alone and you are strange and you are different, you're othered. Another thing is the over-sexualization in conversations about the LGBTQ community. So over-sexualization, that means we are constantly turning the conversation back to sex. So for people who are LGB, so lesbian, gay, bisexual, essentially anything with sexual orientation, a lot of times we'll get conversations about how we have sex. And if we identify with the T, transgender, a lot of times we're asked about our genitals. Did we have the surgery? How do we have sex? What do our naked bodies look like? That can make us see ourselves as specimens, as over-sexualized, and sometimes that our only worth is our sexuality. When in reality, being LGBTQ does not need to be an over-sexualized thing. It's just a part of who we are. Being taught overtly or covertly to stifle a part of your identity creates long-term shame. So if somehow growing up, you were getting the messages that you really shouldn't be open about maybe identifying as LGBTQ, if you're already figuring it out that young, you're pushing a part of yourself down. And if you push any part of yourself down for long enough, long-term shame will happen. Because what happens, so for example, if I was, I don't know, if I was like 10 years old and I went home to my mom and dad and I said, Mom, Dad, I have a crush on a girl. She's so cute. She's so beautiful. I love her so much. A lot of times parents, completely well-meaning, might respond to that and say, honey, no, you're not in love with your friend. She's just your best friend, silly head. You're just confused. Parents aren't trying to be homophobic, but what is happening is that child is now attributing their attraction to confusion. You attribute your attraction to confusion, and you realize that you can't necessarily trust your own feelings, that you are just confused. That can cause you to question your choices later on, especially in coming out. So a big place where we see the LGBTQ community is in gay bars, gay clubs, and the ball scene. And while these places can be a lot of fun and super positive, they also lead to risky behaviors such as substance abuse and unprotected sex. And this is why we see the statistics skyrocket for the LGBTQ community, especially gay men who have such a large presence in gay bars, gay clubs, and the ball scene, are oftentimes alcoholics, oftentimes struggle with substance abuse, and oftentimes find themselves at risk for STIs, STDs, and HIV. So according to the 2019 Trevor Project National Survey, the 2021 is not out yet, but I think it should be coming out pretty soon. So this is the study on LGBTQ youth and mental health, and we found that 39% of respondents seriously considered attempting suicide in the last 12 months. That's almost half. More than half of trans and non-binary youth have seriously considered suicide. 71% of the LGBTQ youth reported experiencing discrimination due to their sexual orientation or gender identity in schools. When you don't feel safe or comfortable in your school setting, it does a lot more than just making you uncomfortable every day. You might also start skipping school. And when you start skipping school or just zoning out completely, right? Because that's a survival tactic. You're in class and you're kind of blocking out the whole world because you're so afraid of being discriminated against or bullied. That might stop you from making friends with peer groups. That could also stop you from networking with teachers who can then connect you to resources, forming and modeling a healthy relationship with an adult, helping you to get into college and write you letters of recommendation. These are things that a lot of young LGBTQ people miss out on if the level of discrimination is severe. So it's something to really think about here and why we need to talk about this as counselors. Now, yeah.
Sorry about that. Renee was asking, what exactly is the ball scene?
Oh, the great question. So the ball scene emerged around the 60s, 70s, 80s, and 90s. And the ball scene was the back when it was illegal to have gay bars and gay clubs, they had what was called the ball scene, which were kind of like underground clubs where the LGBTQ community would come together and dance and party. So they would do Vogue dances. There were a lot of drag queens and drag kings. It's starting to make a rise again now that drag culture is coming back, but that's what the ball scene is. It was very underground and secret because it wasn't safe to have big open gay bars. Did that answer your question? All right,
I haven't
awesome.
put anything else. So thank you.
No problem. I highly recommend, if you're interested in learning more about the ball scene, watching the documentary Paris is Burning. It is on Netflix, and it's one of the best documentaries in my opinion. It goes all into that. Also, if you're familiar with the show Pose, it's all about the ball scene in the 80s and 90s. So I'm going to call myself out a little bit here. By going through the last few slides covering mental health risks and the stats that are stacked against the LGBTQ community, I am kind of perpetuating the at-risk model of research. And what that means is that the vast majority of research about working with the LGBTQ community is about the risk of substance abuse, suicide, bullying, HIV, and more. And while these are really important to understand, especially as counselors, otherwise I wouldn't cover it, but the overuse of the at-risk model sends a clear message to our culture that being LGBTQ is a risk, that you, in coming out, are putting yourself at risk. At PFY, we work with a lot of parents and families, and a lot of times parents will share with us, I'm just so afraid for my child, or I just don't want you to have a hard life. And the truth is that although we do live in a culture where the risks are very real, there are also beautiful, spectacular things about being in the LGBTQ community that people who are not in the community don't have the chance to experience. So as counselors, you can use the strength-based model instead of the risk model. If a client comes out to you as transgender, you can say, congratulations. What does that mean for you? What is it like for you to think about your gender in such a unique, rich, intense way? Have you discovered more about yourself through this process? We're going to be going more in detail later in the presentation about specific things that we can say as counselors, but I wanted to address right now that this at-risk model sometimes does more harm than good. And we want to work against it by not overemphasizing it in counseling or letting the risk define the community. So in this next part, we're going to talk about dysphoria and then the DSM-5. This subject is extremely important because so much of working with the trans and non-binary community includes working with dysphoria. It's really important the way that we approach dysphoria and our knowledge about it, and therefore how we can soothe it as counselors. So the word dysphoria, what are we talking about? It is not to be confused with dysmorphia. So the difference between gender dysphoria and dysmorphia is that dysphoria is gender related. So therefore it's almost exclusively experienced by trans and non-binary people. So there are three major types of dysphoria. All three are unique to each other, and not all trans people experience all three. Some may only experience one or two. And a person's level of dysphoria does not indicate one's level of being trans. Someone is trans if that is how they feel, and dysphoria just may or may not be a part of that experience. So why don't we start at the top? We see gender dysphoria. Gender dysphoria is the distress or discomfort with the sex you were assigned at birth. So gender dysphoria in a nutshell is I came out of the womb. For whatever reason, the doctor said, it's a girl. And throughout my life, I'm treated as a girl. I'm living my life as a girl. And somewhere throughout my life, I realized this doesn't click for me. This doesn't feel right. I feel distressed and uncomfortable with being seen as a girl. That's gender dysphoria. So if we keep going around the wheel clockwise, we have body dysphoria. Body dysphoria is the distress or discomfort with your body's secondary sex characteristics and gender presentation. So the focus is on your body. It's a little more specific. So an example of body dysphoria, let's say that you are a trans woman. So you are transitioning to be a woman. And let's say you still have facial hair. You might experience body dysphoria when you feel your facial hair, when you look at your face in the mirror, and it's so uncomfortable and it's so distressing that you want to rip your skin off. So it's more than just maybe annoyance. You look in the mirror and you're like, oh, I feel kind of insecure about that. It's very, very distressing. That's body dysphoria. The focus is on the body. And then we keep going around the wheel, and then we have social dysphoria. Social dysphoria is the distress or discomfort with the gender that others perceive you as. So this has to do with what other people see you as. Now, body and social dysphoria can kind of overlap here, and I think you'll see what I mean. And a good example of social dysphoria is, let's say that we're not living in COVID-19 and I'm going out to Starbucks and I'm getting myself a latte, and the person gives me my latte and they go, "Here you go, sir." They called me sir, but that's not how I identify, and that makes me really uncomfortable to think that this is how this person sees me. I feel so uncomfortable that because of that situation, I might not want to leave my house for a couple of days. So there's a lot of debate about the definitions of dysphoria, both outside the trans community and within the trans community. There's actually a lot of controversy here. And I think that's okay to acknowledge as a counselor, because as always, we're trying to meet the client where they're at. And we want to explore what dysphoria means to them and their specific experience. So one of the debates you might hear about if you're working with the trans community is whether or not you need dysphoria to be trans, if that is something that you need to have. Some people also have debates about the different kinds of dysphoria. Is dysphoria just one big thing, or are they separated out like this? So I want to provide you all the information I have as counselors, but remember, it is not our job to tell clients how they should feel about their experience. We just want to have the information we have and meet the clients where they're at. And it's always okay to acknowledge if it's a little bit controversial. So gender dysphoria and the DSM-5, I have a photocopy of the diagnosis of gender dysphoria and the DSM-5. So back in the DSM-4, the experience of being trans and non-binary was actually listed as gender identity disorder. And I'm so happy that changed, because that's so stigmatizing, right? Gender identity disorder, like being trans in itself is a disorder. So now in the DSM-5, this was actually changed to gender dysphoria, which I think is great because it highlights not the experience of being trans, but instead the struggle of gender dysphoria. So what is the purpose of gender dysphoria being included in the DSM? Is it to say that being transgender is a mental health issue? So interpretations across providers vary, but affirming counselors and affirming agencies use the DSM criteria for gender dysphoria as a tool to connect trans people to gender affirming care. The DSM is a tool, and what I mean, like an example is, if I'm a trans boy and I want to start hormone replacement therapy, so I want to take testosterone so I can appear more masculine. I want to do this because it would make me feel so much more comfortable in my body. It would decrease my body dysphoria and decrease my social dysphoria, and it would help me improve my quality of life and my mental health. In fact, for a lot of people, it can be life-saving. So if I'm a trans boy and I want to start hormone replacement therapy, I need to be able to prove to the insurance company that this is not cosmetic and should not be billed as cosmetic. So in fact, it can be considered life-changing or life-saving. So as mental health providers, it's important that we use the DSM-5 diagnosis as tools to help improve our clients' quality of life and connect them to resources. So we can diagnose somebody with gender dysphoria, so that way they can bring that to their doctor and get the services that they need. We do not want to use this diagnosis to stigmatize or label identities as mental health disorders. The DSM is a tool. We don't want to stigmatize or say that being trans is a mental disorder. So how do we work with dysphoria in counseling? Some trans people might want to have medical interventions, but some don't. A lot of trans folks, this is something they have to live with. Dysphoria might be a lifelong experience. So as counselors, we want to be comfortable talking about it and working with it and helping our client learn coping skills. So one thing I like to stress is please be aware that someone's experience with dysphoria might be deeply personal and intimate. I mean, think about it. If you're asking somebody about their dysphoria, you're asking them about their least favorite thing about themselves. It's very personal. So approach it mindfully. And you might want to make sure there's some strong rapport there. When I'm talking with my clients about dysphoria, I do multiple check-ins throughout the session, and I'll say, hey, are we still okay talking about this? Do you want to take a break? Would we like to talk about something else? Just be aware of how heavy this topic can be for others. CBT skills can be helpful. So CBT stands for cognitive behavioral therapy. And if you are somebody who enjoys working with CBT, for some folks, dysphoria can kind of be like anxiety, where you can identify the unhelpful thoughts and replace them with helpful ones. So an example of this, let's say we have a client and they're dealing with social dysphoria because they were just misgendered. As soon as somebody misgenders them, they have thoughts like, I'll never be a real woman. Nobody will ever see me as a woman. I'll always be a man in a dress. As counselors, we can explore those thoughts and then look at what are some alternate thoughts instead that are a little more helpful. How about, this is temporary, change is coming. I'm a woman because I am, not because I need some societal stamp of approval. It certainly won't diminish dysphoria completely, but it can help ease and cope with it. I also have just some quick coping skills for body dysphoria and social dysphoria, but definitely talk to your client individually. Some of these might really help, some of these might not. So for body dysphoria, if you're really uncomfortable with your body, a lot of clients like showering with the lights off. Making sure that your client has access to affirming clothing that makes their body look and feel as close to what they want as possible. If you have a client and maybe she is a trans woman and she is in the closet and can't come out about it, maybe you can encourage her to paint her toenails, just have a little feminine ritual for herself. And then of course, gender affirming medical interventions. So that includes hormone replacement therapy, surgery, facial feminization, laser hair removal, things like that. But medical interventions, please remember that this isn't something that a client just kind of goes into CVS and makes it happen. Like, this is something that has a very in-depth process. And I highly recommend if you are working with a client as a counselor and they are interested in medical interventions and you don't know much about it, please feel free to reach out to PFY. We can educate you a little bit about the process. We can help connect your client to the resources. We can help talk to your client if that's what you need. Just know that resources are out there. It's not this big scary thing. What about social dysphoria? Let's say that you're really uncomfortable with how people perceive you. Make sure that your client has some kind of social support that refers to them the way they want to be referred to. For a lot of our young clients, this is online. A big thing right now is Discord, Discord servers. Discord is kind of like this huge chat room, and there are a lot of trans affirming Discords, LGBTQ, gay, etc. Making sure that they have support services outside of just counseling. Also, sometimes what helps is being aware that gender is a social construct, right? It's something that's enforced by our society. And sometimes people can feel a little bit better when they realize that gender is just enforced different across all different cultures. This isn't a me problem. I am not wrong for being who I am. This is just how my culture enforces gender. So in this next part, we're going to go through some simple do's and don'ts as counselors to the LGBTQ community. And these can help navigate framing conversations and asking questions, small adjustments that might make all the difference so your client feels affirmed. But I really want to highlight that these tips, I really encourage you to follow them across all your clients, not just your LGBTQ clients. I know so far in this presentation, we've been talking exclusively about out of the closet, out and proud LGBTQ people, or people who are just out to you. But the truth is, many of your clients may identify in the community and either they don't disclose it in therapy or they haven't discovered it themselves yet. So on average, trans women come out in their 50s and 60s. On average, trans men come out in their 20s. It's also common that you might have a client who is a girl discussing her boyfriend in session, but actually identifies as bisexual or pansexual or asexual. So what I'm saying here is that it's really important that us counselors, we don't just whip out these skills as soon as a client comes out to us, but instead we use these skills to create an already established safe space for clients to open up and come out. So a lot of these do's and don'ts were actually written by our clients. Like I said in the beginning of the presentation, we talk to a lot of clients at PFY and we ask, what are some things that your therapist has done that you loved or your therapist has done that you don't love? So a lot of these came right from the community. Do ask your clients their pronouns. Ask all your clients their pronouns. What you're doing is you're asking for somebody to tell you how they want to be referred to. A way that I do this is I say, hi, I'm Maria. I use she, her pronouns. What's your name and your pronouns? This makes a world of a difference. For a lot of LGBTQ folks, therapy can be the safe space for them to try on different names and different pronouns until they feel clicked with one of them. So being open to using new names and new pronouns in your therapy sessions, this might be the one space where they can try it on and try it out. Mirror the language your client uses for their body. So this is a big one, especially if you're working with a client who deals with a lot of body dysphoria. For example, I had a client who we were talking a lot about his body dysphoria. He was a transgender man and he hated saying the word bra. He hated it. So instead he said, my chest thing. So me as a counselor, I mirror that. And when we were talking about it, I would say your chest thing. I wouldn't then say your bra. So mirroring the way that your client talks about their body and the things that they put on their body. This goes for anything, not just the LGBTQ community, but do research, attend trainings, learn things you're not familiar with. And when it comes to the LGBTQ community, you could always reach out to me, reach out to PFY with questions. We love talking to other providers and helping to serve the community. And speaking of teaching, be teachable. It's so powerful to say, if I do or say something unaffirming, please let me know. I want you to feel safe here. Set the precedent that it is okay to make mistakes and learn and grow from it. So do ask questions about their coming out story, about how their identity has impacted their life, what their relationship with the community is, what resources they've used in the past to connect with the community. So these are all strength-based questions. Give resources if you have them. Now you know of PFY and me, so you already have a resource. So I know in the mental health field, there's a lot of conversation about self-disclosure. When is self-disclosure appropriate and when is it not? When it comes to the LGBTQ community, self-disclosure can be a really powerful tool. A lot of young LGBTQ people, especially a lot of young trans and non-binary people, have never met a trans or non-binary adult. And it can be so healing, so therapeutic. So if you are in a session with a client and it is appropriate to bring up your identity and they're LGBTQ as well, I really do encourage it. It can make a really big difference. Responding to their identity in a positive and excited way. So if somebody comes out to you as LGBTQ, show that you're curious, show that you're excited, not scared or confused or just completely apathetic about it. Meet them where they're at. Not all LGBTQ people are accepting even of their own community. Internalized homophobia or transphobia is very common. So when we say internalized homophobia, that's when you have self-hate that is projected as hate towards your own community. So meet your client where they're at. Don't assume that they have certain, the LGBTQ community is stereotyped as being very liberal, leftist, right? But that's not always the case. So meet them where they're at. Don't make any assumptions based on their identity. And this is really important and might not be as relevant since we're virtual, but ask your client if they're trans, ask them what name and pronouns to use in session, but also ask what name and pronouns to use around their family. So some clients might be comfortable telling you that they want to be called a certain thing, but they might not be comfortable telling their parents or their friends or the waiting room, etc. So by asking that, you're asking them for consent to come out. So some don'ts. Don't misgender your client. Of course, I want to say that mistakes happen, and if a client uses a different pronoun than what you are used to, you might slip up and it's okay. And if you do, you just apologize and move on. You don't want to make a big deal out of it and make it seem like a big thing. But I want to be honest with you all. If you do misgender your client, the rapport will hurt. It often does. It's something I hear a lot from our clients at PFY. So I really want to stress, try your best not to misgender your client. Of course, unless they specifically ask you for safety reasons. Like we said before, don't assume anything about your client based on their identity. Ask questions. Don't ask about how your client has sex, what kind of genitals they have, or if they've had the surgery. Of course, if it's relevant in session and in your therapeutic work, that's completely different. But if so, even be mindful of how you ask. There's no harm in introducing the topic by saying, hey, you don't need to answer this question if you're not comfortable, but this is a safe space to discuss sexual topics and ask the question. So just being mindful about that. And I say be mindful because, like we said before, the LGBTQ community is so accustomed to being over-sexualized that you want to make sure that they're aware that you're not trying to over-sexualize them. That's not what this is about. But of course, on the other hand, if you are working with a trans person and maybe this is the first time you've worked with a trans person, you're very curious about how it works, your client is not your source of education about that. I highly recommend you to do your own research. Do not ask inappropriate questions to your clients based on your own curiosity. Don't assume the gender of any of your clients' romantic or sexual partners. This is a really powerful one and also a really small one. So really quick, just if you're completing an intake with a client usually and you're asking if they have a boyfriend or girlfriend, instead just ask, are you seeing anyone? Ask, what is your spouse's name? Just very gender neutral terms. What you're doing is if somebody is, say, in a relationship with somebody in the same gender as them, you're not making it so they have to come out to you. Like, oh, actually I have a girlfriend, or oh, I actually have a wife. Instead, you're just laying it out there that no matter what, it's okay. It's not this big, strange thing. And like we were talking before about the at-risk model, don't focus on the risks and hardships of being LGBTQ unless your client leads you there and unless there are real concerns there. I'm not trying to say avoid the negatives of being LGBTQ, don't avoid the risks that might be there, especially if that particular client has a lot of risks, but we don't want to emphasize it. We want to emphasize strength-based questions. So an example is, instead of asking, was it hard to come out? Did people accept you when you came out? Instead, ask, what were some new things you learned about yourself in the coming out process? Did you learn anything about the people around you? Things like that, strength-based. So creating an affirming environment in your own therapeutic space, like we talked about in the beginning, here are some more merch. So all the way on my right, I don't know if it's the one with the peace sign and the yellow, pink, and blue, that's the pansexual colors. The one in the center, that is the pride flag that also includes the trans colors and also the black and brown stripe to be inclusive of the black and brown LGBTQ community who really spearheaded the community. And I include these pictures not just because I think they're cute, but they also send a message right away. But most importantly, these accessories aren't the point. The point is the non-physical therapeutic space we create as counselors with affirming language, inclusive questions, not assuming someone's identity, and helping to make them feel safe enough to speak about their identity. So these things are fun, but they're not the point. So I've been saying the word affirming quite a lot, but I want to take a moment and really define what we mean by affirming. Some of us might have heard terms like acceptance, ally, tolerance, supporter, but at PFY, we believe in an active allyship, which is an ongoing process of learning and growing, linked with active, consistent advocacy. So when we look at the word acceptance, I accept your identity, it implies that there was a barrier to overcome. So like, I accept my morning commute. I don't love it, but I accept it. This might be a good first step, but it's not the attitude that we want to convey as counselors. So there's no judgment if that is what you are thinking and you are feeling as a human being, but as counselors, we want to portray an affirming attitude. So to be affirming, I celebrate your identity. The space is already created. You do not need to feel like a burden in coming out. I already asked you your pronouns. I use gender neutral terms in talking about your spouse or your significant other. The space is already made. You do not need to take up more space or feel uncomfortable with that. So affirming the LGBTQ community is just a part of who you are as a worker. It's not a skill that you whip out as soon as your client comes out. So you're positive, you're excited, you're curious, and you're teachable. So more about being an actively affirming counselor. I love this picture here. This was one of our events, and it really makes me miss when we did fun things in person. So having LGBTQ merch in the office, advocating in your place of work for LGBTQ trainings, maybe saying, hey, we haven't done a training on the LGBTQ community. Why don't we get somebody in? PFY does free professional trainings. That's why I'm here. If you have a front desk staff, creating your client charts, advocating that the client charts reflect what the client wants to be called. Different clinics have different rules and legalities about having a legal name attached to the client chart. So I understand that's a little bit nuanced, but there's some advocacy that we can do. Your body language. So we learned this as counselors, right? So you have to watch your body language and facial expressions when the LGBTQ community, any topics come up. So if you have a female client and she says, my wife, and you thought that she was straight, what does your face say? So just checking that. And of course, checking your biases, we all have them. And again, do your research. You can always give PFY a call. The number is right here and my email is right there. I'll put both of those things in the chat in a little bit as well. But if you ever have questions or your client has questions, you need resources, you can always reach out to us. Lastly, don't be afraid to assess. I know sometimes folks will feel like there's so many do's and don'ts with the LGBTQ community. I'm afraid to even broach the topic because I don't want to do it wrong. Don't be afraid to talk about it. Don't be afraid to bring it up. So how do we assess as counselors? So being mindful of tests. Some LGBTQ people might test your reaction to topics without outwardly coming out. I cannot tell you how many clients I have who are non-binary, who've told me that their last therapist, they would start bringing up their non-binary friend just to test the counselor's reaction, just to see if the counselor would use they, them pronouns for that person. And if the counselor was respectful about that non-binary friend, then the client would feel more comfortable coming out to them. This is something folks do a lot before outwardly coming out, which is why I say use these do's and don'ts across the globe, across all your clients. So again, this is something that might seem a little strange, but don't be afraid to bring up potentially identifying as LGBTQ. So if you have a client who consistently brings up topics about their body discomfort, say you have a client and she is really uncomfortable with the size of her breasts and she keeps bringing it up, you might want to explore with her, you know, are you comfortable with your gender identity? And talk about dysphoria, because that might be gender dysphoria. It might not be, but it might be. Same with if you have a client who keeps coming in and saying, I don't understand why I don't feel sexual attraction to this person, and I'm trying my best. It might be appropriate to ask questions about sexual orientation. Have you ever heard of the asexual community? Have you ever found yourself interested in somebody of the same gender as you? So bringing those things up can be appropriate, because when you pair those questions with an ongoing affirming attitude, it comes off as neutral and supportive, not judgmental. Thank you all so much for letting me be here and listening to me chat. I'm so happy to be here and answer any questions that you have. But that was my presentation. I will also put my contact information in the chat right now. This is my email. Oh, oops, I sent it as a private message. So that's my email. The office number for PFY is also here. So feel free to take that down. Does anybody have any questions? Now I'm looking at the chat. I'm seeing there's a lot.
If anyone wants to unmute and ask a question, that's perfectly fine now too. Well, thank you. Yeah, Maria, for real, thank you so much for this. This was extremely informative, and just so great that we have a space like this where we can all meet and have these types of conversations.
Thank you very much. Please do not hesitate to reach out to me if you have any questions, if you want a phone call or chat or anything like that. I'm happy to be a resource. Thank you all so much for having me.
I also just have to say, when you were talking about if you are a provider, if you work out with people involved in any system, if you identify as part of the LGBTQ plus community, that it's okay to self-disclose. I'll self-disclose I am a gay man, and I normally don't bring that up because I try to keep it suppressed because I'm afraid of what people will think or what they'll say, but I feel like this is a safe space. And about 2 years ago, I was at a board meeting, and the director came in. He was a new director at the time, and I don't want to say who it was because I don't want to out anybody without their approval. But he sat down and he introduced himself, and he said, I'm an openly gay man. I love my husband, X, Y, and Z. And I can't tell you how much that meant to me. Like, my heart warmed. I almost started crying because it never occurred to me that I could be who I was in the workplace. I always felt like I had to hide that part of me. And it's just that it was so encouraging and kind of life-changing even to say that someone was as established as they were and as far up the totem pole, and they were so unapologetic about who they were. So it just that is definitely a great point.
That was so beautiful. Thank you so much for sharing that.
Thank you.
Were there any questions?
I see that Dawn put a question. She said, thank you so much. This is a great presentation. It helps us to understand how to address these topics. My daughter is bisexual and it's awesome. But the first question was, how do I address you? I guess that was more of a statement.
Address me as far as like my name and my pronouns, or address me like how to contact me? If you need to contact me, I'll put my email in the chat again. But in talking about me or addressing me, I just go by Maria, and you can just use she, her pronouns for me. But thank you for asking. Awesome. Thank you, everybody. Thank you so much.
Alrighty. If there are no more questions, I guess we can wrap up. If there are any questions, we'll be happy to stay on for a few more minutes or whatnot. But for those of you who want to sign off, thank you so much for being here. And Maria, of course, thank you so much for offering all that you do.
Thank you. I'm staying on just in case.
Perfect. All right, I'm just going to stop the recording.